tested?
We don't know yet. That evaluation is still going on.
Let's bring in Dr. Seema Yasmin. She is a public health professor. She joins us from Texas, and Dr. Frank Esper joins us as well. He's an infectious disease specialist. Seema, I want to start with Nurse Hickox here. She is set to be released. She is set to be transported to Maine. What concerns do you have now about her and whether she will develop Ebola symptoms?
So it's reassuring that now the policy seems to be aligning more with the science. The fact that she's had negative tests and that she does not have any symptoms means that she can go through the procedure that was originally agreed between her and the organization Doctors Without Borders, which is that for 21 days after she returns home, she should stay home and she should monitor her symptoms, monitor for fever at least twice a day. We know from speaking to other doctors, in reality, they're actually monitoring very many times in a day. Some take their temperature, in fact, every hour or every 2 hours. This was the agreement that she had, and she knows that she has to be checked for 21 days, avoid public places, perhaps just stay at home. There's always a possibility that Ebola could develop. We know that it doesn't always develop, though, and we hope that she stays healthy. But it's really important that this policy about being able to stay at home, having dignity, and being able to self-monitor and stay in contact with health officials is observed.
Self-monitor and this idea of dignity, we really get that. But I think, Dr. Esper, one of the things, at least, you know, from the outside view, there may be people that say, look, do these home quarantines work? We saw what happened with Dr. Spencer. He was going to a meatball shop, taking the subway and going for a jog. We also look at Dr. Nancy Snyderman, who returned from West Africa with her NBC team and didn't fulfill her quarantine obligations. I know those are two cases, and I know the vast majority of most medical professionals will say, I'll do what I need to do and I'll stay put. Bottom line, do they work?
Yeah, you know, the answer is yeah, they actually do work. And this has been used to control epidemics, not just here in the United States when we're dealing with, you know, a very few amount of Ebola exposures patients, but all across in other areas around the world as well as in Africa itself. You have to understand that the infectiousness of this germ grows as you get sicker. And so while you're still up and about and walking around, you don't have a lot of virus in you. You do not have a lot of virus to give to other people. You are not very contagious. It is when you get very, very sick, when you become bedbound, is when you really become the most contagious to other individuals. Which is why when we actually look at all the individuals who have Ebola here that we've been treating for in the United States, returning missionaries, returning physicians, or nurses who are in direct contact with individuals who are very, very sick with Ebola. Those are the people you worry about developing the disease, not the casual contacts of individuals.
Dr. Yasmin, you know, there is this legitimate public policy debate right now about what to do or how to treat the public health professionals who come back from these 3 West African nations. What should they go through when they get here? What happened in New Jersey, though, even if you fall on the side of these people need to be quarantined for 21 days, is a tent with no shower and a portable toilet, is that the right way to do it?
So this really sent a message to the public health community and the medical community that they could be quite frightened when they return home from West Africa, that this is how they would be treated. And Nurse Casey Hickox was outspoken about how she felt about being treated, being in this tent, as you mentioned. She hasn't been able to shower since she landed. When she asked for showering facilities, they gave her a basin of warm water. So the public health community in New York said it's really important that they have a heads up, that they're able to prepare, so that if there is a policy where you do want to quarantine returning troops, returning healthcare personnel, you can do so in an appropriate manner. You can treat them with respect, with dignity, and make sure they're comfortable. And that really helps people maintain that quarantine situation if you give them provisions and make them comfortable.
I want to turn, Dr. Esper, to the 5-year-old at Bellevue. The little one that returned with his family from Guinea, developed a fever, 103, and we're told earlier that he was being monitored, but we do know now that the child has been tested. Can you help us understand why testing isn't done almost immediately? Is it painful? Is it risky?
Expensive?
Is it expensive? What is the concern? Because it seems to me the first thing that you'd want to do to say, okay, we have a negative here, carry on.
You know, the answer is it's not risky, painful, or even expensive. The problem is, though, that you need to do it right. And in order to make sure that we want to have the most effective as well as accurate testing, there's only certain ways that we will test that we have already made sure that they are accurate, that they are valid, and that they're very sensitive. And sometimes that requires those tests to be done. Some will be on site at the actual emergency departments and at the hospitals, but also to be ensure that they are confirmed by the state labs or the Centers for Disease Control themselves. The testing themselves is a blood test. Most of the tests that they will do early on is going to be, and I don't want to go all half Latin on you, but it's going to be a PCR, which basically is looking for the virus itself and tells us, do you have any of this virus in your blood or not? If it's not, or if you have any of the antibodies to that virus in your blood or not. Those are very, very sensitive tests, but anything can be negative. And so they have to make sure that they are accurate and that they are sensitive enough in addition to the symptoms. I will tell you, a 5-year-old with fever and vomiting, well, welcome to my world. It's
yeah,
November
exactly.
here in the United States.
Come to my house on Tuesday, any Tuesday.
Yeah.
You make a very good point. You make a very good point. I love this team with us. You guys get to the bottom of so many of these questions that nag at both John and I throughout the day. We appreciate it. Dr. Esper and Dr. Yasmin, thanks so much.
Thanks.
Ahead for us at this hour, she is being released, but was the New Jersey decision to quarantine Nancy Hickok to begin with, was that decision legal? For lawyers, he's filing a civil suit against the state. Let us know what you think. Should states quarantine those from traveling from Ebola hot zones?